Professor Emanuel is the Vice Provost of Global Initiatives and the Diane V.S. Levy and Robert M. Levy University Professor, as well as the co-director of the Health Transformation Institute of the UPenn. From 2009 to 2011, Professor Emanuel served as the Special Advisor for Health Policy in the White House. And also, he has been the chair of the Department of Bioethics in the US NIH for many years. At the same time, he's also a breast oncologist, very busy person. So Professor Emanuel was one of the architects of the Affordable Care Act, also known as the Obamacare. He also served on Biden's COVID-19 Advisory Board. In his recent book, Which Country Has the Best World's Health Care, very interesting and thought-provocative book, he assessed and compared the healthcare systems of the US to 10 other different countries in the world, including Taiwan, and also making implications on the country response to COVID-19. So today he's going to talk about the lessons we learned from COVID-19, especially focusing on the public health behavior change and pandemic response infrastructure. So let's welcome Professor Emanuel.
Thank you. Thank you. Can you hear me?
Yes.
Can you hear me without it?
Yes.
Okay. It's wonderful to be here. This is my third trip to Taiwan, and it's fascinating. Obviously, all through COVID, fascinating to see Taiwan's response and how prompt and early it was. This is mostly going to focus on the United States, but I think there are many, many lessons that are cross-cultural, as you will see. I'm going to talk about 12 lessons. That is going to be an article published in the New York Times with other colleagues of mine who were on the President Biden's COVID Advisory Board. There are 6 of us who developed these. And then I'm going to talk a little bit more in depth about the vaccine distribution worldwide. Last year, that is in almost exactly a year ago, in March of 2022, I led a group of 25 or so experts in the United States to release a roadmap to define how we should go forward in the United States. It was basically the second strategic plan laying out how a country lives with COVID, and in particular what the United States had to do going forward. We have to, our view was we had to shift the discussion away from COVID to think about all major respiratory viruses, because COVID was just one. There are going to be others. We don't know which ones are going to be a problem. It could be influenza, but there might be rhinovirus, adenovirus could become pathological. And I think all countries need to think about how they prioritize and improve their public health preparedness. Sorry. In the United States, our response, the special powers that we have to respond, that ends on May 11th. That'll be the end of special provisions for collecting data, special provisions for distributing, and all the special team at the White House will be disbanded. I don't know about Taiwan, but I can tell you in the United States, there's, by politicians, very much an interest in moving past COVID and not talking about it ever again. All right. Now, many countries, for example, Singapore's released a report on their COVID response to try to analyze it. Many countries are trying to take stock of how they've done it. I can report that many other countries are not paying attention at all. I was just in Israel. They have no interest in having a national commission look at how they've done, what they did well, what they did badly. So I don't know if countries are falling into two parts, but there are those. The United States will not have a formal assessment of how we did on COVID. We're just not. Some of us got together and did an informal assessment, which is this book just got published last week, actually. What went well, what didn't go well, but a formal idea. We want to forget about it, and no politician wants to continue to do that. So there are these informal assessments which are now happening. So I'm going to ask, what can we learn from our COVID experience? The first one is, I think we can learn pretty well that there is a very strict limit for how long we can endure a crisis. I think we can voluntarily endure major changes in our life, masking, social isolation, etc. And the limit is 24 to 30 months. That is it. Interesting, if you go back to the flu in 1918 and 19, 1920, 1920, it lasted round about 5 years, diminishing in importance. But it was also after about 2 years that people were fed up and did not want to do anything more. You can see this. Some of you are wearing masks. This is the audience I've seen the most masks in the world. Again, I was just in Singapore, India, Israel, London. Taiwan has more people wearing masks than any of those other countries. But in general, and I will get back to that, I think most people have reverted to their routine behaviors. And by the way, one of the things that's pretty common is people who revert to their routine behaviors, and when you wear a mask, they hate you. And you frequently get, why are you wearing a mask? You don't have to wear a mask anymore. Now that you've taken off the mask requirement here in Taiwan, maybe that'll return. We need to understand that limit, the 24 to 30 month limit, when we plan for the next pandemic. Because, depending on when it happens, this one was a century after the last one. No one was alive who lived through that. People will forget, and they may forget this important time limit.